Hello and welcome back to Phenom Industry Week 2024. I'm Bill Ventiker, your host for today's deep dive into the healthcare industry. The healthcare sector employs over 20 million people in the US and faces unique HR challenges including high staff turnover, burnout amongst healthcare workers, and the constant need 24 hours a day, 7 days a week for highly skilled professionals and patient-focused frontline hospital staff. HR in healthcare is vital for ensuring the right talent is in place to provide quality care, manage patient needs during times of high stress and rapid change, and implementing continuous professional development programs. Today, we'll explore how healthcare organizations can build resilient workforces, tackle talent shortages, and enhance employee retention through innovative AI and automation solutions. Remember, all of our sessions will be available on demand 1 hour after we end today, so you can share these valuable insights with your teams. Join us in the chat and register for more great sessions later this week. Let's get started. Our first speaker today is Jeremy Sadler, the CEO and Executive Director of the American Society for Healthcare Human Resources Administration. ASHHRA is the premier organization for healthcare human resources professionals dedicated to providing education, resources, and networking opportunities to enhance HR practices in healthcare. They play a crucial role in shaping the future of healthcare HR and ensuring the well-being of all healthcare workers. Let's welcome Jeremy as he shares best practices for creating a resilient workforce in healthcare. Hi everyone, welcome to another exciting session from Phenom Industry Week. I'm thrilled to have you all here as we continue to explore the unique challenges and opportunities that each of you face. Today, we're honored to focus on the healthcare sector, a field that's constantly evolving and plays a crucial role in our society. With us today is a distinguished guest who's been at the forefront of shaping the future of healthcare HR. Please join me in welcoming Jeremy Sadler, the Executive Director and CEO of the American Society for Healthcare Human Resources Administration, or ASHHRA. Jeremy, thank you so much for joining us.
Thank you for having me. Thank you to Phenom for putting this on.
So to start us off today, I would love to jump right in. I think ASHHRA is an amazing organization. I'd love for you to share how ASHHRA supports HR professionals in healthcare and give us an overview of the mission there and how HR professionals are addressing the challenges in healthcare by partnering with you.
Sure. So, we obviously are a healthcare HR society. So our membership is made up of healthcare HR professionals and frankly, primarily leaders in the healthcare HR space. As a healthcare society and an HR society, our goal is to better the HR experience for those that are practicing in healthcare. And then obviously, I think as everyone who works in healthcare expects and hopes is to have some positive impact ultimately on the clinical care that people receive across the country. So ASHHRA has been around for the better part of 60 years. And I've been the executive director and CEO for the past 3. And before that, I was a subject matter expert for about a year with ASHHRA. But before that, I was a healthcare HR professional and leader and executive, and also an ASHHRA member. So the reason that I came to ASHHRA as a member was to have a community and have a network of people that I could lean on, ask questions of, resources, tools, and really be able to immerse myself in the profession and with the people that do the same work that I do. Human resources is a very complex role and a very complex industry to work in, obviously regulatory heavy, particularly in healthcare. And we at ASHHRA are there to meet the needs of those professionals and those leaders that are doing this type of work.
I love that. And it sounds like you really have an amazing pulse on the challenges and need for collaboration across healthcare. When we were talking a little bit as we were getting to know each other, you talked about this need for the association to encourage this concept of leadership courage and why that's so vital for HR leaders in healthcare. Can you talk a little bit about that?
Sure. We've got a lot of challenges in healthcare, and a lot of those challenges, frankly, revolve around reimbursement and the fact that healthcare is not, while there is a lot of money that changes hands in healthcare, the margins in healthcare are razor thin. And as Medicare and Medicaid go, so do private payers. Medicare and Medicaid are not usually in the business of giving us more money. So as a result, we find ourselves in tougher and tougher economic times. Margins are thinner and thinner. Um, the days of fee for service are long gone, and as a result, there's less and less revenue and in the healthcare industry, and frankly, less and less income for us to pay for our biggest expense which is our people. So when it comes to managerial courage and leadership courage, the thought process for me is we need to fight for our people. We need to fight for those FTEs. We need to make sure that executives, as times are tighter, we need to make sure that our finance folks and our COOs and our CEOs are not thinking just for the short term, but thinking for the long term. And as FTE budgets shrink, we need to make sure that we push back where that's appropriate and use a little bit of that relationship capital. More than ever in healthcare HR leaders have a bigger and more prominent voice than they probably ever have before. But if you don't use that voice, you'll lose that voice. And having some courage to say, I understand that this is a down year. I understand that to hit our targets this year, we need to have reductions. But please understand, if the expectation is to reduce a certain number of FTEs this year, and next year's budget, we're going to put those right back in. Make sure that those other executive leaders understand the cost of re-recruiting those employees, the cost of the severance program that you may be putting out there. You are likely to see a negative financial impact on the organization in reducing FTEs and then re-recruiting them a year or 6 months later, just based on the cost of recruitment. So the thought is, use your voice, make sure that those other leaders within your institution understand that your people are your most precious resource, and we can't always follow the dollar when it comes to the people side of healthcare. Totally understand, no margin, no mission, but we can't put margin over mission, and we have to make sure that margin this year isn't affecting next year's margin when we need to go out and re-recruit all the people that we let go, or positions we didn't fill when the opportunity existed in the prior year.
I think we have certainly heard across industries that financial pressures are an opportunity for HR leaders to speak up and engage with business leaders in a proactive way rather than just being reactive. So I'm so glad to hear that you're pushing that and enabling HR leaders in healthcare to have this conversation. There's a lot of other pressing issues that HR leaders are facing today. Let's maybe take one additional step down on this same kind of conversation. What are you hearing from other members of ASHHRA about the biggest challenges in healthcare hiring and retention today? And how is that different from maybe how it was 5 years ago, before the pandemic?
Sure. Well, we've got a lot of the same challenges that we had before the pandemic. Labor shortages, obviously inflation and paying a livable and sustainable wage, competition from other industries. I mean, healthcare was somewhat insulated in past decades, but as technology has started to play a greater role in healthcare, we tend to be in the same competition with other industries for talent. So, those are a few factors that are always impacting the workforce, impacting our hiring process. And the fact is that there's also a changing dynamic in where care is being delivered. If we think back a couple of decades, you had acute care settings that had a real variety of patients in terms of their illness. And across the board, case mix index in hospitals is up. And those folks that typically would have been inpatients in the past are being moved to home health services. They're seeing the and getting their follow-up in doctor's offices, you know, surgeries that would have been done in the hospital and had a couple of days of inpatient care afterwards are now being done in surgery centers and people are being sent home. So the fact is that care has also changed over the course of the last couple of decades and will continue to change. There will be more and more growth in outpatient services, surgical centers. Pharma's having a bigger impact on the healthcare space than it ever has in the past.
All right. So those are really critical issues. And the fact that we do have an aging population that is only going to require more and more critical patient care in the coming years is something that I am hearing loud and clear. It's impacting HR operations. I think there's also this ongoing movement for interoperability and digitization of all of your processes in healthcare. So, given all of these challenges, what do you think is the greatest opportunity for solving them? Are you seeing a lot of adoption in automation or the use of AI on the HR side in healthcare? And how is that helping in terms of job creation and modifying career paths and things like that?
So let's start off talking about that aging population. We think about that as there will be more consumers of healthcare resources and more folks utilizing the healthcare system. However, that also means that there are fewer people and that will be providing those clinical services. As our clinicians age, they will be aging out of the workforce. And that means that we need technology to help adapt to what might be fewer people able to care for patients in the future. That change and that transition has been really burdensome on the industry. The fact of the matter is that we don't produce enough graduates in our medical education programs, in our nursing programs, in many of our therapy programs, our pharmacy programs to really meet the needs of the industry. And that is a product of the fact that there are folks that would love to be in those programs. There are applicants for those programs. There just aren't, frankly, enough spaces for those programs to graduate enough to really meet the needs of the industry. So the first thing I would do as a healthcare executive and leader and as the executive director for ASHHRA is implore my partners in the healthcare HR space to reach out to your educational institutions, to the places that you are receiving new grads from, whether it's in nursing, whether it's in therapies, whether it's in pharma, and say, what can we do to expand the number of graduates coming through your program? And, until everyone in the industry does that, we will constantly have a shortage. Technology is never going to fix the need for the human element. However, as we've seen in every technology change in healthcare, technology ultimately finds its footing. It creates new opportunities. It makes us more efficient. It makes us better clinicians. AI is going to do that in the relatively near future. There's a great survey out there by the American Hospital Association, the AI landscape in healthcare, and what that says, and that was done in partnership with Optum, I believe, or at least some of the data that they've used is from Optum, that 43% of the hospital leaders out there, when surveyed about AI, feel like the first place that they want AI to impact the system is really in those administrative tasks, things that are repetitive, transactional, manual today. Well, healthcare leaders, by and large, have identified administrative tasks, those that are manual and repetitive and transactional, data focused tasks, as the place that AI will make its first foray into healthcare. Because of that, you can think about the types of roles that are at the sort of front end of the healthcare continuum. Those scheduling services, automated phone calls, evaluating and finding efficiency in the way that we schedule our patients, the way that we ring patients in the healthcare HR space, in frankly, the way that we recruit our employees, and using tools like AI to make sure that the time that was once spent sourcing can now be spent in person interviewing more candidates, the efficiency of onboarding to make sure that those tasks that were otherwise manual in nature related to the onboarding process and the training process and the licensure process can happen in an automated fashion through AI technologies. Those are the ways we're going to gain efficiencies and hopefully, as individual institutions, then be able to have a leg up on our competitors.
That's a really key part. You talked about the competitive nature of healthcare at the beginning, and I think that every opportunity that an HR team can take to improve that competitive attraction part of the business is really, really important. Thanks for making that point. We're running out of time here, and I have a couple more questions I wanted to ask. I think every one of our listeners would be really interested to hear what you're thinking about for future trends and what they should be paying close attention to over the next few years. So looking ahead, what trends in the healthcare industry do you think they should be watching out for? And in particular, there's this rise of labor unions playing a role in HR as well. What future trends do you think people should be thinking about?
Yeah, well, I mean, we talked about AI. So, AI is going to play a role in everything that we do moving forward. Whether it's the competition for talent, our recruiters are going to be using AI tools, the adaptation of current roles to AI centric roles or AI roles that are using AI. Our employee labor relations folks are going to be spending time adapting for AI in that space. Performance evaluation, talent pipelines, we'll be using AI technology to make sure that we have a stronger and stronger workforce through technology. As it relates to union organizing, there's been a big shift in the last couple of years in terms of who is organizing. Historically, healthcare has been organized in your nursing arena, in some of your other clinical services, in your support services, environmental and food, and those areas. And historically, and by and large, your clinical staff, your interns, your residents, your fellows, and your attending physicians have typically not been a group that has been organized. Much in the same way that in most of healthcare, professionals have not been organized. What we have seen in 2023 and has become very prevalent in 2024 is that more and more interns and fellows and residents are organizing. And if you look at the number of attending physicians and house staff physicians that have typically been organized, it's somewhere in the neighborhood of 7%. However, in the last year and a half to 2 years, we are now looking at about 20% of our physicians in training and residents that are organized. And for healthcare leaders, you have to look at that and then understand that the dynamic is changing, the tide is rising on union support. And even if you don't have medical education happening within your institution and you don't have any organizing going on, with 20% of the population of those physicians in training and residents and fellows now being organized, it is reasonable to assume as you hire your house staff, as you hire your attendings in the future, they are going to come, at least some portion of them, with some union experience. And that may be positive experience, that may be negative experience, but the fact is that the clinical staff and that provider staff have taken to unions in a way that they historically have not, and it has the potential to change the industry. You might be asking yourself why they're organizing more. Well, there's been a significant reduction in autonomy. There are very burdensome tasks. Physicians, particularly young physicians who are and novice physicians who are getting used to new tools and resources and don't already have efficiencies in their jobs. And that lack of autonomy, those burdensome expectations, the unfortunate reality is it is consuming their time while at work, consuming their time that would otherwise be spent at home, and that work-life balance is being negatively affected by those things, and therefore they're looking for a third party to help them alleviate some of the struggles. The other thing I would say is that organizing in general has been on the rise, and is as disparity in wealth and disparity in income have been more and more topical in our political discord and the discussions that you see, on the news. People are much more aware and much more interested in finding out how organized labor and a union may be able to help them with that disparity.
Well, thanks for sharing that, Jeremy. This whole thing has been so interesting, and I don't have exposure to a lot of the really key insight there. We appreciate it so much. So before we conclude, I'd like to end with maybe just hearing the 3 key takeaways that you would leave with this audience, or maybe even tell them where they can go to get more information from ASHHRA. Just sharing some of those resources from ASHHRA.
Sure. A few key takeaways. Organizing is going to continue. So if you have not been involved in labor organizing and you're a novice, find a partner. AI is going to change our industry. It's going to change the work that we do in human resources, but it's going to change our industry in ways that imaging changed our industry, in the way that pharma has changed our industry. AI will change our industry. We had a keynote speaker at our ASHHRA 24 conference this year in Fort Worth, and he spoke to the inability for humans to be able to understand and predict drug interactions. You can predict drug interactions between 2 drugs. It's much more complicated when you predict it between 3 drugs, and lots of people are on 4, 5, 6 different medications. And it's impossible without AI to understand all of the impacts of those medications on the human body in concert with one another. Those are ways that AI will ultimately change the way we practice medicine in this country. And human resources and human capital is going to have to adapt to that. The last thing I would say is we are here as stewards of our FTE budgets, stewards of the people that ultimately make healthcare what it is and treat people every day. And we need to treat those folks with respect, understanding. We need to advocate for them where it makes sense. And we need to be stewards for that resource. If you think about supply chain, it's all about stewardship. If you think about your CFOs, they're thinking about stewardship. We have to be stewards of our most our most precious resource, frankly. And those are the humans that take care of other humans every single day. If you want more information about ASHHRA, we'd love to have you come take a look and get to know us and hopefully find enough value in what it is that we do that you become an ASHHRA member. If you need some additional information, on specifically what's going on in 2024 in healthcare labor organizing, feel free to reach out to me directly. We can include my email address, and I'm happy to send you the ASHHRA Chessboard Consulting Labor Report. And you can go to ASHHRA.org, that's AHHRA.org, to find out more. We hope to see you there.
It's great advice. Thank you once again, Jeremy, for your time and your insights. It's really been a pleasure speaking with you.
Thanks for having me.
And thank you to everyone for joining us for this session today. We hope you leave with some new ideas and some inspiration to tackle these challenges that all of you are facing in healthcare HR. Can't wait to see you interact in our next session. Thank you so much for being here today. And thank you, Jeremy.
Thank you.
Thank you, Jeremy, for those critical insights. Up next, we have Yvette Hansen from Baylor Scott & White Health, who will discuss their winning formula for talent attraction and retention. Yvette is the Director of DEIB and Talent Attraction at Baylor Scott & White Health, one of the largest not-for-profit healthcare systems in Texas. Committed to providing comprehensive healthcare services, Baylor is known for its innovative approach to healthcare delivery and its dedication to improving patient outcomes through exceptional talent management. Let's hear from Yvette about the strategies her team is using to overcome talent challenges in the healthcare sector.
Hello, everybody. Welcome to Phenom Industry Week. Today is Healthcare Day, where we're focusing on healthcare challenges and solutions and getting stories from folks that are in the trenches and solving these problems in a very meaningful way. Today, I'm super excited to introduce one of my favorite people that I've met. I've been able to spend some time with this person in the past through a couple of engagements on a podcast episode and also doing a roundtable or fireside chat at the I Am Phenom conference last year. But it gives me great pleasure to introduce Yvette Hansen. So Yvette is the Director of TA and DEIB at Baylor Scott & White Health in Dallas, Texas. Yvette, I cannot do your title and job justice. So welcome to the show. Welcome to Industry Week. And will you give the listeners just a little bit of background of what you're focusing on?
Sure. Thanks so much, Luke. Again, Yvette Hansen. I'm the Director of Talent Attraction and DEIB here at Baylor Scott & White Health. And the work that I am focused on is really leading our recruitment marketing, our sourcing, which is focused on passive candidate engagement, and of course, our DEIB programs, processes, and policies throughout the system.
Excellent. Excellent. And again, thanks so much for joining us. Guests, as we're listening to this, we're going to break this down into 5 topics for you. So I'm going to give you those at the beginning, and then Yvette and I are going to jump right in. So we're going to start with the challenges being faced at Baylor Scott & White, the solutions and strategies that Yvette and her team are using, the impact of technology, the future outlook for what it looks like in AI in healthcare, and then some takeaways so that at the end of this, hopefully you can just go and implement this in your own organization. So Yvette, let's start with some of the challenges faced. So in today's competitive healthcare space, candidates really expect a seamless and personalized interview experience, right? Competition is fierce right now in healthcare with the staffing pressures. So given those unique pressures you and your colleagues face in healthcare, like high stress levels, demanding workloads, and the need to rapidly scale for the business needs, right? Can you share some specific recruitment challenges that you're facing and the impact on the business goals?
No, absolutely. And you're absolutely right. Candidates want that more personalized approach, but they also want it fast, which is one of the areas that we're focused in on. We need to make decisions quickly. Not only are a lot of the positions that we recruit for and fill in any hospital or healthcare organization, not only are they revenue generating, but they're critical to ensuring that we're giving the highest patient quality care. And so when you think about that, and you think about the sense of urgency our candidates are having, we have to be really assertive in our processes. They're looking for organizations that want to court them quickly, and give them the most aggressive offer we can against the competition. So that's one area. I know this is going to sound like a broken record. I'm sure you've heard this 1,000,001 times, but we can't say it enough. The talent pool shortage is remarkable in our space. And everyone knows about it with regard to nurses and physicians. But we're feeling that in every area of patient-facing roles, whether it's respiratory therapists, whether it's rad techs, or other roles that require certifications, because schools can't generate enough of those graduates. And a lot of the folks who held those roles are the boomers who are now looking at retirement. And so that's another area. And then you talked about that intense competition. Hospitals are growing, healthcare providers are growing, but other organizations or industries are tapping into the same market that we're pulling people from, which is healthcare professionals, right? And so when you see non-direct competitors like finance and technology seeking out from the same talent pool, it does crazy things to salaries and benefits. It makes recruiting that much more challenging. So those are just some of the things that we're up against that we're addressing that very much affect our business goals.
Absolutely. And I mean, you're in a very competitive market as well, being in the Dallas Metroplex. I can
Yes.
only imagine the stresses that puts on the workforce in the Metroplex right now.
Well,
Uh,
there and the greater Austin area. I mean, there is so much growth happening. We're growing in Austin, as are two of our other competitors. And so you're competing against these other hospitals, and you're like, who's going to get there first? Who's going to open that wing up first? Who's going to build out that floor first? Because the person who gets there first can start people sooner. So that competition is just so, it's so remarkable right now, because we've never seen it like this before.
You're absolutely right. And I feel like it's snuck up on us a little bit too. I know that for the past decade, we've been saying, oh, by 2030, it's going to get really bad, but I mean, heck, it's 2024 right now. We didn't forecast a pandemic coming. And then if anyone looks at the news, I mean, the amount of people that are moving to the Metroplex and Austin is staggering. That was not the situation 10 years ago. So I can only imagine the challenges and how that's impacting the business from a solutions and strategies perspective. All right. So we all know that healthcare HR leaders really need to be innovative to meet the demands of the challenges you just articulated. What strategies have really helped you overcome the challenges, like, the rapid scaling of the workforce, like you mentioned in Austin?
So one of the things that we did was we looked at the need for speed, right? Maverick said it. I believe him. We believe him at Baylor. So we had to rethink our interview process and what that looked like from a candidate perspective, and our hiring leaders. And so we sat down and we said, okay, if we keep the candidate at the center of everything we do, we have to understand what's important to them. Well, their time is important to them. Getting an offer is important to them. Not only an offer, but an offer that is top notch, that they can't say no to, that's competitive in the market. Both direct and indirect market is what we're talking about. And so we developed what we call a candidate process, which is really, again, keeping the candidate at the center. We do one interview, and it's not always an in-person interview. Most of the time it's a virtual interview. And the hiring manager has 48 hours to respond and say yes or no. Do we want to move forward with an offer? So there's no more delaying the process. There's no more multiple interviews. And we did a lot of market adjustments. I mean, I think we made the national news 2 years ago when we made a huge investment in market adjusting the nursing teams across the system. So, and we're continuing to look at the pay rates for all of our positions throughout the system to make sure that we're being fair, competitive, and equitable within the industry. In addition to that, we launched something that we refer to as our employee voice campaign. One of the things we knew would resonate with potential candidates is to truly understand authentically and genuinely what it's like to work here at Baylor, what it's like to experience a specific role, but then to see your career grow. So we actually recruit team members to be part of those campaigns. There is not a single image that you'll find on our career site that isn't truly an employee of Baylor, isn't a team member. And whether it's growth campaign, whether they grew their career, whether they leveraged a benefit, got tuition reimbursement, had some educational accomplishment, or perhaps an award, maybe a partnership with one of our DEIB partners that they wanted to share about their experience. So things like that, that our team members really want to share and that folks want to hear about. One of the other things that we did, which I'm really excited about, is we piloted a program that we refer to as Fast Track, where we have an AI bot pre-screen our candidates. We piloted this in just a small subset in one specific market to understand, could this work? And if it did work, what could the results be? And what the pilot consists of is, I'm a candidate, I'm pressed for time, I get asked 5 questions, and if I answer those favorably, I get the opportunity to schedule an interview directly with the hiring manager. I no longer have to be screened and wait for a recruiter to get back to me. I still have to complete the application, but that comes after my scheduled interview, or after I get to schedule my interview. Before I meet with the hiring manager, that application has to be completed. But how much more incentive could you give someone to complete the application than, hey, you're already scheduled with the hiring manager. Go and complete this application and we'll make sure you get in front of them and nothing's going to delay the process. So we piloted that about 7 months ago and we're really excited about the results there.
Yvette, this is amazing. And thank you so much for mentioning Maverick. I think, Top Gun is one of my favorite movies. And you're right. The need for speed. We often think about our hiring process and the time to start as how quickly can we get them into the organization. But I think if we look at the other side and say, well, how many candidates can honestly wait to go without a paycheck for that long? And are they taking jobs that they don't necessarily want because someone was the first one to reach back out to them? The statistics show 65% of the time a candidate will take a job that they don't want just because they were the first one to get offered. So transitioning into the impact on technology, how are you getting the need for speed, right? Using your employee voice campaigns and then utilizing things like scheduling that interview before they even finish the application. How are you implementing that with technology and what's the impact of it from a business perspective as well?
Yeah, so we started looking at AI and machine learning and automation probably about 2 years ago. The fast track process is one of those items where we use AI to really speed up the interview process, giving candidates an opportunity to meet with us sooner, which then results in them giving an offer. But I will say this, we've been challenged by our CHRO, John Frampton, to really think about how we're reaching out to the folks before they even apply. So we don't even consider the starting process at application. We think our reach is our starting process. So that's where the employee voice campaign comes into effect. So how can we get this content developed faster? And so we look at different pieces of technology to really help us reach the masses. A few years ago, we partnered, or actually it was a year ago that we partnered with a vendor to help us with our job postings. So we analyzed one job posting. And so we have over 2,000 templates that we use for our job postings. And we analyzed one and we found bias and our readability score was really high. And as everyone knows, you want a readability score to be low. And so we partnered with this vendor who would help us identify what bias exists in our job postings, what exclusionary words are in there, improving our readability score. But it also allowed us to pull in our competitors' job postings so that it could give us an analysis of how we were promoting our roles against how our competitors were promoting their roles. This really helped us because it could automate the change that you made to one template to all the templates for the same job code. So it just really allowed us to be able to do that really quickly. If we go back a little bit further, and we talk about our employee referral program for our internal team members, right? So we had a very manual process put into place where there was no transparency. The report backs were just like Excel spreadsheets. So we put into place some technology to help streamline that effort. And the change is fantastic. It's remarkable how much a piece of technology that automates a process that provides transparency and complete reporting and connection points to our finance, to our CRM, to our ATS is fantastic. We saw an over 200% increase in referrals. And now I think referrals remain the top 5 sources of our hires. Very often, most months, it's the top 3 source of hire across our system. So that's been really promising for us.
Wow, what an amazing success story. And I think every talent acquisition leader knows referrals should be at least in the top 5. If not, like the goal is to get it to be one of the top, right? Very few can actually achieve that though, especially in healthcare, because you are just moving so fast and the stress is so great because of the labor shortage, right?
Mm-hmm. Yeah.
So looking forward, how do you see AI and other emerging technologies evolving recruitment and talent management strategies in healthcare specifically? Um, do you think that it's going to be more of an assistant for folks? Do you think it's going to reduce headcount? Do you think it's actually going to give us more resources in healthcare based on where the market is going and the tools you're seeing?
I don't know about reducing headcount. What I do know is you can do more with less.
Yeah.
Using AI, automation, machine learning. I think if you use it responsibly, it's not really for us. It's not about reducing headcount. It's not about labor costs. For us, it's giving back time to people to do what's most important, most critical, the human interaction that we can't ask a bot to do for us. So it's really going to be a supplement. And we love piloting things. So we'll pilot something to understand, can it augment a process and give back time to our recruiters, our coordinators, whoever it is we're talking about, to do the things that a bot can't do, like consult, right? Develop a network, socialize items. Sourcing is still always going to be really key. One of the things we're finding in healthcare is the active talent pool seems to be shrinking. That means we have to really address the passive talent market, which means we need people to call people. We need people to call leads, generate relationships, sell them on our opportunity, connect with them, and continuously network. And on the flip side, we need them to collaborate with our hiring leaders, act as consultants, tell them about what's happening in the labor market, explain to them about the shrinking active talent pool or the talent pool availability in that specific geography. So no, a bot can't do those things. So those are the things we're giving back to our recruiting team members when we automate a specific process. So if we automate this, it's not so that we can get rid of recruiters. It really is about giving them back time, because as the landscape is changing in the healthcare market and the talent pool shortages and everything else we talked about, we need to have them evolve their roles and get back to the basics of networking, relationship building, consulting.
Yeah, I think you're absolutely right. And that's what we're hearing around the industry as well. I don't think there's a world where AI is ever going to reduce headcount in recruiters. What I think it is going to do, and what we're hearing from other health systems, is allow that recruitment team to spend more and more time with the candidate, explaining not only what the mission, vision, and purpose is of the organization, but helping them find the right fit. Because one of the best things in healthcare is there's pretty much a job for everybody, no matter what you want to do. Now, that's an upside. Usually the benefits are great. You have great coworkers, and there's a nice career path built into healthcare. So it's very attractive to folks. If you're looking at a different industry that might not have that, they're going to naturally say, hey, I want to be in healthcare, right? But when we don't have enough time to explain the jobs, especially to the emerging workforce and the folks that might be getting their first job, it's very easy to get a person into a job that might not be a fit for them. So for me personally, like let's use emerging workforce, let's say dietary, right? And facilities. I would love to work at Baylor Scott and White. I would crush it on your dietary team. I love food. I've been in the food service industry. I'm also qualified for facilities, but Yvette, I can't fix the faucet. I would not last a week on your facilities team. It'd be an awful fit. And without having the recruiter to tell me what that experience is and what the job actually entails, that might be a miss for me, right?
We need to explain to them why choose Baylor, and and tell them, if you're interested in facilities, you can't fix the faucet today, but is it something that you're interested in? We can develop a career path to make sure that you get that exposure and that experience. And we can even potentially introduce them to someone who's had a similar background and made transitions from one area to the other. But to your point, we need somebody who's actually going to connect with those individuals, have those conversations, and give them reason to further explore us.
See, and that's what's scalable. When we look at recruitment teams, just doing the same thing over and over again, to me, and I think to other health systems, is not necessarily scalable. It's critical thinking, sharing that passion with somebody and helping them find the right fit. That is the only thing that scales. So for your takeaways, would you mind telling folks in the audience how they can future-proof their own healthcare system? What actionable takeaways would you leave them with? And then wrap us up with doing a little self-brag, because I think you won a couple of awards not that long ago. So we'd love to hear about that too.
Oh, thank you. Thank you. Yeah, the takeaways are actually really simple, to be quite honest with you, Luke. The first is there is not a magic bullet. There is not one tool, one solution that's going to solve everyone's problems, right? So for us here at Baylor, as I mentioned earlier, we love to beta test and pilot things. So if somebody calls me and says, hey, we are rolling out this new solution, here's what we think it'll accomplish for you, but we don't know. Would you be interested in beta testing this for us? I never say no. If I really believe that it could, in fact, yield the results they think it can, we'll absolutely beta test something. We'll pull a pilot together. This fast track that I shared with you, it's probably one of the things I'm most excited about, only because they came to us, they said, we think you'll yield these kinds of results, but we're not sure. We haven't tested it in healthcare, and we haven't tested it the way that you think you'd want to see it. So we designed the process. They had the technology, and we said, well, let's try it. So we designed the process. We did some studies here internally. And within this small pilot, where 100% of candidates were being screened by a recruiter, and from end to end, from the beginning to the offer, it was taking about 20 minutes per recruiter. And on average, we were seeing about 7-to-1 interview to hire ratio. We launched this pilot for 6 months to see if it would work. And it went down from only 8% of those candidates now needed to be reviewed by a recruiter. And it's usually because they worked here at some point and we needed to get, confirm whether they were eligible to be rehired. And that screening went down to 3 minutes per screen. And then our ratio went from 7-to-1 to 3-to-1. I mean, those results are fantastic. We've decided to go ahead and roll that out to other areas, other positions, and other facilities. And so I think that that's just a really great example of this is something you can do. It may not fit exactly what you were looking to do or what they think it can do, but if you design it, you should try it. And you shouldn't let fear get in the way. But always socialize this and provide complete transparency. Because I will tell you, we were met with resistance by business leaders because they felt like, you can't put somebody on my calendar who I haven't even reviewed their resume. Nobody's talked to them. So we were met with their resistance. We were met with resistance from the recruiters because they were fearful. Like, you're taking me out of the process? Am I going to be losing my job? But once we shared with them, look, like this isn't for all positions, right? This is for the positions where we know we get a good volume of candidates. There are other roles that you're responsible for where you're not getting a volume of candidates. The talent pool shortage is real in those positions. That's where we need you to spend your time. We need you to spend your time networking and sourcing and cold calling and consulting. And so that's what we're giving you. We're going to take this off your plate so that you can focus on these things that really matter and where you can make a greater impact. So that's where I think I would say some of those takeaways are. Obviously, pilot, provide transparency, communicate the changes. And remember, there isn't a magic bullet. It's all about trying it, figuring out, tailoring it to your needs and the end goal that you're looking to accomplish.
Yvette, I absolutely love it. I mean, the most dangerous words in business, right? Or we've always done it this way. Mm-hmm. So I love that you're being creative, that you're taking mindful risks, right? To push the business forward. And it shows in everything that you're doing. So before we wrap up, tell us a little bit about the awards you won. Do a little self-brag for us.
Well, thanks. Yeah, no, we're excited. So we won 2 Rally Awards this year, and one was for our career blogs. So we're really proud of that. We spent a lot of time making sure we're connecting with our team members and sharing their stories. And so that was probably the one I'm most proud of, because career blogs are almost this thing where people say, do people read it? Does it resonate? And it does. And we didn't know how much it resonated, not only with our external population, but with our internal population. people really want to share their stories. People really want to know or want to share what's happening and with them and how they're making a difference within their own lives, but the lives around them. And so we're so proud of that work. And so thank you for asking about that. Whitney Wallace is our recruitment marketing manager, and we could not have accomplished any of that without her.
Of course. I mean, it's so cool, the innovations that you're making there and the things that you're trying and finding success in. Like, I truly believe if someone's listening to this and they say, hey, I'm going to get to where Yvette Hansen is, I think when they get there, they'll be where you were because you're still growing, right? So you're still growing and learning.
We have so much to do, Luke. When it comes to automation and when it comes to figuring out where people's time really needs to be spent, it's one of our favorite things to do here is really figure out, like, are we doing the most impactful work that we can be doing? Are we leveraging the technology available to us? I mean, I just think about talent management too. We just started investing more in talent management so internally people can flourish their careers, but really have an understanding where that's going. But I look at the technology that's being offered to us because I've sat in on some demos. And just the automation that they can apply so that there's complete understanding and no guessing games around where someone can take their career based on their skills, experience, and where others have taken their careers. Like, they start doing that kind of matching technology where they can say, well, this is how 3 others in your industry or in your field develop their careers, which may not be at all what I thought I could lead into. So I just think it's fascinating to me. And we're so excited to see what's next.
Well, I'm fired up. If I please give me that interview if I apply to Baylor Scott and White, which, by the way, listeners, I could have gotten that interview on the schedule in the time it took to listen to this. So
absolutely.
Well, thanks so much. Please come back and share your wisdom with us again. We really appreciate it.
Absolutely. Thank you so much. It's been a pleasure.
Absolutely.
Thank you, Yvette, for those fabulous insights. Now, let's move on to our Phenom expert presentations. We'll begin with strategies for high-volume hiring and talent intelligence, followed by the talent experience engine and segmentation for healthcare, and end with career pathing and frontline experiences in healthcare. Let's get started.
Welcome to Industry Week. Today, we're diving deep into the heart of the healthcare industry to discuss one of its most pressing issues, the challenges of hiring healthcare talent. I'm Saqib Nasir, Senior Director of Product Management at Phenom, and for the next couple of minutes, we'll explore the complexities of recruiting healthcare professionals and how Phenom is revolutionizing the way companies attract, engage, and retain top talent. The healthcare industry is a vast and dynamic sector, encompassing hospitals, clinics, pharmaceutical companies, medical device manufacturers, and more. It's one of the largest and fastest growing industries globally. Driven by increasing healthcare expenditure, technological advancements, and an aging population. But with this growth comes significant hiring challenges. Let's break down the top hiring challenges healthcare companies face. Number one is shortage of skilled professionals. The demand for healthcare services is outpacing the supply of qualified professionals. We're seeing shortages in roles such as physicians, nurses, and allied health professionals. Now, competition for top talent is also another challenge. High demand specialties in regions with limited access to healthcare services create intense competition for top talent. Another big thing is regulatory compliance and credentialing. Strict regulatory requirements and complex credentialing processes can delay the hiring process. Another big challenge is employee burnout and turnover. High levels of burnout and turnover, particularly among frontline workers, that poses significant retention challenges. Now, we've all seen technological advancements rapidly. Keeping up with the rapid technological advancements requires continuous training and upskilling. Diversity and inclusion, of course, is top of mind, but promoting a diverse and inclusive workforce, even though it's essential, but it is challenging. Compensation and benefits. Offering competitive packages is crucial to attracting and retaining top talent. Now, these challenges might seem daunting, but this is where Phenom comes in. Phenom is a cutting-edge talent experience management platform designed to transform the way healthcare organizations hire. Here's how Phenom makes it easier. Number one thing is our enhanced candidate experience. Phenom's personalized career sites and chatbot provide candidates with a seamless experience, keeping them engaged and informed throughout the hiring process. Now, of course, the AI-powered talent acquisition is a big game changer. Phenom uses AI to match the right candidates with the right roles, streamlining the recruitment process and reducing time to hire. Of course, automated screening and scheduling plays a big role as well. With automated screening and interview scheduling, recruiters and hiring managers can focus more on engaging with top talent rather than administrative tasks. The next big thing is the events experience. Events is one of the most fruitful experiences when it comes to lead generation, especially if you're trying to move qualified candidates through the funnel and hire them faster. With Phenom's messaging experience, talent marketers and recruiters are able to spin up regular or drip campaigns within minutes. This way, candidates can always stay up to date and nurtured. Now let's take a look at a couple of experiences, how Phenom is changing the game. Now here I am on a branded healthcare company website, a healthcare company known as Big Heart Health. As a candidate, as a nursing candidate, I'm able to interact with the chatbot. Now, of course, it asks some basic terms and conditions agreement. Right away, I'm able to see a branded video, which tells me a little bit about the company. It may even be about the day in the life of a registered nurse. From here, I'm able to identify what am I most interested in. Of course, nursing. Any specializations I may have. I'm a registered nurse. What sort of experience do I have? I'm a seasoned nurse. And right from this, I'm able to answer some filtering questions, which will get me to a couple of job recommendations that are appropriate for me. Great. From here, I'm able to see there are a couple of jobs here, 5 to be specific, but this one is only 2.5 miles away from my home. I'm able to say I'm interested, share some basic lead generation experience or information, which is my name, my contact information. And right from here, I'm able to answer a couple of screening questions, nursing certificate, my 18 years, can I work? And then here is the next step. Within minutes, I'm able to go from an anonymous candidate to a lead, and now showing interest on a specific job into scheduling a 30-minute conversation with the recruiter. I'm able to go through an inline scheduling experience where I pick the time that works best for me and move on from there. Now, this specific experience is also asking me if I have any friends that I'd like to refer. I'm going to say yes. And just like that, I'm able to refer my good friend Paige Turner and then go through with the application process. It's that easy. Now I'd like to walk through an experience where the talent marketer or an event coordinator is setting up an event for early talent or nursing students. It's as simple as going into the events experience. Now here what we've done is we have generated templates or recommendations that we're providing around the context of the jobs that you may have or the industry that you're hiring for. In this scenario, whether an event that you're trying to conduct is online, in person, it's a recruitment event, a networking event, a brand exposure event, any sort of event, you're able to come up with this event experience through the Phenom platform. Now here, let's say I picked one specific template. Now what this does is it creates the shell of an event where I'm able to see some basic information, who the target audiences are going to be. I'm able to set up booths or sessions and identify specific jobs that are going to be I'm going to be hiring for at this event. Now, if we go through this event experience, we are recommending some of the estimated cost or potential leads or staff that is going to be required. We're automatically generating the event description, when this event is going to be conducted. I can identify who the team members are going to be. Now, this is the interesting piece where we are actually recommending, based on the context of your jobs that you're hiring for at these events, we're saying that, hey, University of Pennsylvania may be a top school, or because they have relevant population of students that are nursing students for that matter. Right? Or how many hires in the past you may have gotten out of University of Pennsylvania. So it's super simple. I'm also able to get recommendations around automations that I can set up. What really we have heard is, hey, how can we automate a lot of these mundane tasks, such as setting up reminders or post-event setting up campaigns where we're keeping the candidates nurtured. So you're able to do that right through this experience. It's really that easy. So I've now created the event. I haven't published it yet. I'm able to get some additional recommendations. So if I wanted to set up a pre-screening questionnaire or video interviewing experience, I'm able to do so that by the time the event happens, I am getting the qualified candidates through the funnel faster. And that's it. Your event is now published. From here, let's talk a little bit through the lens of the candidate. Once the invitation goes out, the candidate receives a curated, branded email to the inbox where it's saying, hey, Josh is the candidate's name here, want to kickstart your career in the healthcare industry. Now from here, Josh clicks on the view the event and is taken to a branded experience on the career site. Now here, I'm able to see, I as Josh am able to see when the event is going to be, who the organizer is, what some basic information about the company is, and how I can register. Now, once I register, I'm taken to the homepage, and from here, the day of the event, I can join the event right from this experience. Once I join the event or the candidate hub experience, I'm able to start answering a couple of questions. And these questions are important because it'll provide the context of the recommendations around information or jobs that are going to be recommended to me within the event. So by answering these couple of questions, I am taken to the lobby of the event on the day of the event. Healthcare companies are able to show curated content, rich content such as video. Here, Josh will get some recommendations based on the interests that he provided or the questions that he answered. Recommendations could be around roles as well, or sessions for that matter. Once Josh decides which session he's going to be part of, I'm able to see that it's a live video experience. So as the conversation is going on, there's a summary or transcription that is happening for the conversation, which is going to be available post-event. Here I'm able to see what the session is about, the speakers, the relevant jobs. I'm able to dig deeper into what the job is about, see the job description, what the responsibilities are going to be. And then post-event, I am receiving this campaign email, which is basically thanking you to attend the recent webinar, the event that I attended. From here, I'm not only getting the customized resources, but I'm also getting asked to join the talent community, or for that matter, in the future, to apply to specific jobs. Now, we know that the healthcare industry is vital to our society, and hiring the right talent is crucial to its success. Phenom is here to help healthcare organizations navigate these challenges with innovative solutions that streamline the hiring process, enhance the candidate experience, and improve retention. Thank you for joining us for Industry Week. Together, let's build a healthier future with the right talent in place. I'm Saqib Nasir, and we'll see you next time. Thank you.
Well, hey, everybody. I'm Sean O'Donnell, Director of Product Management for the CX team here at Phenom, and really excited to talk to you today on Healthcare Day, talking about all of the great technologies that Phenom is thinking about in the healthcare industry. Recruiting in healthcare is a very difficult industry. There are so many various factors at play here. So first of all, your talent is scarce. So everybody's trying to fight for the same talent, and you need to create an experience in your career site that attracts, engages, and ultimately converts those people in a quick manner. And we do that at Phenom already, but in healthcare particularly, we use our algorithms to give the recommendations and quickly figure out who is looking for what job, and ultimately get the right job in front of them so that the application goes as fast as possible. So there's a great return on investment when you buy Phenom in the healthcare industry, because we're going to decrease the time to leads, which decreases the time to interview, which ultimately decreases the time to close your jobs. So you get the right people in the right positions as fast as possible. So what I want to talk to you today is how we're using our technology to hyper-personalize the candidate journey at scale. And what that means is that every interaction that the candidate takes through their experience with your website and with your recruiters and with your chatbot personalizes to their needs. An example of that would be if I identify early on that I'm a nurse looking for a nighttime nursing job, why would I care about any other job not related to that? And that's what Phenom allows you to do. As we build profiles on candidates, we can change content instantly at scale and make that journey most applicable to what anybody's looking for. And again, that's really for the sole purpose of reducing the time to apply and getting the right people in the right job. So what I'm going to show you today is the Talent Experience Engine. It's our next leap forward in generative AI. We've been doing AI for 10 years now. And really, AI had 4 focuses. It was there to give you an automation, an insight, a personalization, or generate something now in the realm of generative AI that you could do. It would normally take a manual task. So the Talent Experience Engine brings all of this together in one area and hyper-personalizes at scale for your industry. Let's go in and take a look at it. So here we are in the Talent Experience Engine. I'm in the dashboard right now, and you can see right off the bat that the dashboard is my one-stop shop for everything that I'm doing in the talent marketing space. So let's say I'm a small talent marketing office at a company. I have to hyper-personalize at scale, which means I have to give people personalized content at every interaction. And now I have a whole library of content that I've created over the last 10 years. The Talent Experience Engine has consumed all of that and makes it readily available for you to use anywhere, and then to automate how we use it in any profile. So as we learn more about candidates, we build a more rich profile, and we're able to pick the right content for the right spot in their candidate journey. So our dashboard here has, first of all, broad insights on everything we're doing and any results we're getting, any experiences we're working for. Of course, you'll see a immediate personalization of where I left off. So do I just want to continue with what I was doing, or do I want to navigate to it? Obviously, I want to get into it as fast as possible. Here you're seeing the invention of journeys. We'll talk about that in a little bit, but these are hyper-personalized roadmaps of content to bring your candidates to the action that you're looking for. That could be an event, it could be a recruiter conversation, a phone screen, or in this case, an application to a job. I can set journeys and campaigns into a project. So it might have a specific focus with a specific goal in mind, and I want to know instantly how I am achieving those goals. Of course, campaigns we're not unfamiliar with, but what about campaigns that are automatically generated and completed based on your previous campaigns? The Talent Experience Engine can do that. And finally, the events. So these are all components that you'll see in your dashboard. One of the great things about Talent Experience Engine is the machine can go through your candidate data and individualize into buckets, personas, and segments. A segment may have one person in it. It may have 800 people in it. Typically, as a small talent marketing organization, I would come up with maybe 7 to 10 personas and maybe 4 or 5 journeys. So it wasn't a one-size-fits-all scenario. What we're doing is we're taking that down to the granular level. Now we can create an infinite amount of segments based on any number of components or data that we find out about your candidates, and we can generate an infinite number of journeys for them. So in essence, this is my team in the box. It's giving me the insight into my data, creating the content based on my previous content that's in my brand and in my voice, and it's allowing me to apply it to any segment that I want automatically so that I can do it at scale, or manually if I need to keep my hands on things. Let's take a look at journeys. So journeys are a new concept that we have where you can individualize the content. Sometimes people may need to go to events and you want to do that through a chatbot. Sometimes you want to bring them from a job description to a chatbot interaction to a phone screen. Maybe you have some high volume hiring and you want to do some pre-screening, and that's a part of content. So what the journeys allows us to do is individualize this content for any and all segments. So that's what you're seeing here. I, of course, can create my own journey, but the AI is going to create some journeys for me, and I can select to use those or not. Once I have a journey, there's some automations that want to come with it. If you're trying to talk to all of your candidates at scale, and we're bringing in 10,000 various leads and candidates a day, how are you going to do that with a small staff? Well, you're going to need the Talent Experience Engine to tell you about those data profiles from the candidate, to automate, and to come to actions for each of them. So that's what you're seeing here. Inside of the journey, we keep our automation engine that allows you to set the triggers and talk about the campaigns and generate the things that you need to get people to apply, to get them to register your event, to give you more information about themselves, to trust you as a company, to know that you have the best intentions to find them the right job. You may just need to collect some feedback or some follow-up journeys for folks. That's what you're seeing here. You may have had an event. You may want to get some feedback on the event. You may have had a webinar online and you want to find out, was it useful? You may have shown folks value in these webinars, and now it's time to take it to the next step. So that's what you're seeing here is an automated version of that. I'm back at the dashboard now, and my insights are updating as my data updates. I've worked on different things. I've set new journeys. I've set new goals. Now I want to work on something different. And what I'm going to do in this case is just create some content. So I go into the content area, and obviously there are quick actions that I can make. I can create pages or blogs or posts. Again, the way this is created is by taking your previous material and repurposing it, or learning the language and the branding from it and using it to create new material, generative AI. But it's all here in the dashboard. I can look at what segments this content would go. I could create content by segments. But in this case, what if I just wanted to prompt the AI to start me on a process? So here, in the healthcare space, I wanted to generate some work-life balance and well-being content. And I want to do this for nurses, and I want to promote to professional and personal fulfillment in healthcare as a message. Sounds pretty reasonable. I'm just going to type that in, hit go, and the machine is at it. It's now instantly generating content by considering all the other content I've had. So this is content in my voice, personalized for these segments. So it takes my prompt, it looks for a strategy, it looks for a tone of voice, and then finally it's going to look for an audience or a segment that I want to target. It's obviously going to suggest some segments based on my previous segments and my previous journeys and any previous content I had. So you can see here, it's suggested some oncology nurses, some travel nurses, or maybe some on-call medical staff. And since the machine has come up with this, I as a user want to verify. I want to look a little bit deeper. So I'll just mouse over and I'll get some brief summaries of what is included in each of these segments. Now, I'm a 10-year experienced professional in healthcare, and though these AI suggestions are really great, I have my own suggestions that I may want to do. And in that case, I can always add my own segment and customize it to what I feel. But in this case, I like travel nurses and I like on-call medical staff. So that's who we're going to target with this. So I'm going to save it and move forward. And already it's good to go, set up to generate. I'll just come over here, click generate. And now the machine is at work. And already it's decided that these two segments are indicated here at the top. Let's look at what it came up with for travel nurses. So here's a landing page that may have a form that I want on nurses. So this is content speaking directly to travel nurses, that when they see this and when they land on this, you can see that traffic. You can encourage them to apply or give more information, but you've shown them value about your company, all in your brand and in your voice. Maybe there's an email campaign that you want to send out to folks that you've already touched. And maybe you don't like this email campaign. Maybe elevate isn't the word you want to use. So you can go in and regenerate this and use some different words or some different tone. As we move on down, obviously, we have some Instagram Reels now. We can auto-generate images, video. Again, your content, your brand, your voice, to kind of encourage folks and to speak to them where they are. Certainly travel nurses will be on Instagram a lot. And finally, we may want to do a Facebook post. Again, always with the ability to regenerate at any time. Of course, it's going to show us the score that this content hits, meaning what is the anticipated outcome and how can we get that higher, or if we don't need it to be as high, we can tone it down, or we can regenerate to try to target some more. Finally, you want to be diverse. You want to attract candidates from all different areas and all different backgrounds. How about with a click of a button, we can turn this into any language we want. So say I'm doing this in Texas, and Spanish is a big component of Southern Texas. I'll just come in and add a language in Spanish, and all of this content gets created in that language as well. Okay, so we've created content and we've created journeys. Now we're back at the dashboard. Things are out there cooking. It's going along just great. I'm staying updated by the machine on how things are doing. If it needs my input, it will allow me to do that, and it will notify me that it's needed. But for right now, I just want to generate some new content as well. And I don't want to go to the content area or the segment area. I'm right here. I have my Gen AI prompt, so I'm going to use it. Let's talk about it. So here I am as a recruiter in Chicago, and I need to market to nurses in this area. How am I going to do that? In the Talent Experience Engine, I'm going to give it this prompt and ask it, can you help me? It's kind of human, but it's the way we talk. So help me promote Chicago RN nursing event. I want people to come to the event. I want them to spotlight the prestige, the networking, and the value for them. And guess what? I want to do it on a vacation holiday. So we're going to be doing that on Memorial Day. Let's see what it comes up with. So here we're showing how you generate this project. It's a specific campaign or journey with a specific goal in mind. So I want to generate leads. That's my objective here. I want to target balanced segments all around, anywhere from medical staff to nurses. And I have a strategy here that I'd like to hit. I'm going to select some of those, and the AI is going to go in, generate this, and now I can look at my overview, so a mini dashboard for this project, and see every element of the project, the segments, the journeys, what's the content, the campaigns, or the events that I'm doing, and I'm able to either monitor these as they cook or interact with them with my 10 years of experience in healthcare. My dashboard is also going to tell me what I need to do next, an automation anticipating where I would go and reminding me that I got to get there. And why does it do that? Well, the data will tell the engine this is what needs to happen next because this is what generates more leads for us. So let's go ahead and do any of that because we are at the controls. All right, a final use case to talk about in the Talent Experience Engine, that brand new tool from Phenom that gives you hyper-personalized content at scale at every interaction in my voice, my company's voice, and in our brand. So I just got a call from a VP in another department, and she asked me to help her promote their new mentorship program. This is to match seasoned employees with new employees. We all know the value of mentorship, but do our employees know the value of mentorship? Do they even know we have this program? Well, this VP thinks not, so I'm here to make a campaign to make sure it happens. Let's see how quickly we can do it. So I'm at the generation side of the prompt. I come up with this fancy prompt, pretty simple in my opinion. Just create a mentorship program pairing experienced mentors with young talent. We've done this before. The machine knows what content I will need, what segments to target, and what journeys they need to take. So this is to our internal employees. We created some content. We've created a couple of internal campaigns. And of course, we're looking for the two segments between new staff and experienced staff. And we're going to connect them and we're going to get them to sign up, essentially like getting a application. But that's the ultimate goal here. The target is to make sure that people are signing up for this mentorship program. As this project is out there cooking and talking to all of our employees with our voice and connecting with them, encouraging them to help our fellow employees so that we all rise with the tide, I'll be notified at my dashboard for this project that the goals are being met and maybe there's something I need to interact with. All of it in this one-stop shop, easy to do. It's been automated. It gave me the insights. It's a personalized dashboard, and at any time I could generate new content. This is the world of AI we live in, and this is the Talent Experience Engine working in it. A final thing to look at when I'm in here, when you set goals to a journey or a project, it's good to know when you hit those goals. So you can see here on the right, I've hit my goal for that Chicago RN nursing event. So it's going to predict and automate what my next move is. So obviously here, it's asking me, do I want to contact the registrants? Heck yes, I do. And that will take me on a journey of talking to the registrants and making sure they get what we need. So there it is, the Talent Experience Engine working for you in the healthcare industry. You know your industry is incredibly competitive, and you need the best tools to make sure that you stay ahead of your competition. You're all competing for the same resources. How are you going to set yourself aside from them? The answer is you're going to give hyper-personalized content at every interaction. And people are going to come to your website and feel talked to specifically at every time they interact with your talent companion, your campaigns, your emails, and even your recruiters. There are companies all over the world right now creating profiles for their users, and they're doing this so that they can personalize at scale for them. Phenom allows you to do this in the HR space. It's a rough business out there, and you have to talk to your candidates and your leads in a personal voice. The Talent Experience Engine lets you do that. It's your team in the box that helps you scale to the millions of interactions and not limit yourself to just the 20 or 30 interactions that you as a human could do each day. It's not the future, folks. It's here today. So we look forward to you using the Talent Experience Engine in your industry, healthcare.
The healthcare industry is known for high levels of employee burnout and turnover, particularly among frontline healthcare workers. Organizations must address these issues to retain their workforce and maintain high-quality patient care. So in this session today, we're going to learn what it's like for new employees to find their career path and nurture that through their organization. We'll also take a look at the skills data from an HR business partner's point of view in the Employee Relationship Management System, also known as ERM. So lastly, with an HRBP view, we'll build out a workforce plan to help future-proof their business. So let's get started. We're going to take a look at Sarah. She is a brand new employee. She is an advanced practice nurse, and she's been doing this for about 2.5 years, but she's brand new at the organization, at the hospital system. So at her first day, she's figuring out where she can actually grow her career and expand to plan to go next at the organization. So what you're taking a look at here is her first initial view into the talent marketplace. She has a unique ID that she can easily move through the organization. When she enters in that first screen, typically it's going to ask you, hey, give me all your skills, give me all your information. But thankfully, there's full integration points to understand who she is already without having to do anything. So here she's going to review her profile and actually just link her LinkedIn. From here, it'll understand who she is, her skill sets, and have a complete personalized profile without her having to lift a finger. Now, AI and machine learning technologies are being increasingly utilized in healthcare for tasks such as diagnostics, drug discovery, and predictive analytics. This is leading to more accurate and efficient healthcare deliveries. So why not allow AI to help suggest new areas of improvement for people like Sarah first starting off their career? You're going to see areas like suggestions based on your resume of topics of interest, even areas around her skills and suggesting additional skills in her based on her role that are common, especially in her department. So you'll see that all within these little areas here. Notice that it's going to suggest goals, topics, interests, skills, all based from her department, and potentially what comes next in her career path. So let's get it started. You're going to notice her own personalized talent marketplace home screen. Sarah can receive notifications like you're seeing on top here with opportunities to grow her skills, even though she just got started through gig work. So checking this out, this is for a full care coordination and can help grow that skill. But notice there's little nudges in here that I know HR today absolutely loves, like asking for Sarah to actually complete her onboarding before she moves on and gets too excited about expanding her role yet starting at the healthcare system. From this homepage, you might notice career pathing. That's what Sarah cares about most. So let's see how to get that started. Sarah can set up her career path and find out what adventure would be best for her. Her end goal, though, being an advanced practice nurse, is to be a nurse researcher. So she wants to be in nurse research. And however, she knows there's going to be a journey because she knows she's got some skills gaps there, but how to best find that role. So she sees different roles that would be a match. She can look at things like a pediatric nurse and potentially do that as the next role to get her to that nurse research role. From here, she can learn all about that pediatric nurse, what skills are required, what proficiency level she may have, even people doing this role today that potentially would be a best fit for her to work with and be a mentor with. From here, she can also understand that nurse research role is her final and a third role that she would like. She can see all those roles available and choose that last role. So we'll go ahead and see that nurse research role that she likes and find that. Now, she's got 3 or 4 options that she can choose from, and she doesn't have to choose it right away. That's the beauty of this. She can really expand in her career and figure out which one would be lateral moves, which one would be upward mobility, all to get to that target nurse researcher role. From here, she decided on that match of starting with pediatric area, moving to oncology for her second role, and ending with that nurse research role. From here, she can actually learn all about it again. But the best part is she can start that career path and actually have a customized plan on how to get her there. So you might notice we've mentioned a lot about upskilling, and it's not just about upskilling, right? Of course, that will be there and giving her options and popular courses to take. All of this goes back really nicely to her employee experience profile to keep track of where she's at. But best part is that she can get a mentor to help her get there. So Dane here has been doing that nurse researcher role for quite some time, and she can constantly give that feedback here. That's again, that AI learning from your current employees and making sure that they're serving up the right type fit candidates. While Sarah is excited for her new career journey, let's switch gears now and understand what these new skills for Sarah look like from an HR business perspective. So we're going to transition to the employee relationship management system, or that ERM that we've talked about. From here, it'll be a nice overview dashboard for those HRBPs or users to be able to see what total skills across the organization are needed, which ones we have an overview of, and things like unique skills with certain groups they can get an overall look at. So if we wanted to look at a specific department like radiology, for example, you might notice that all this information will continue to grow and look at specific filters, and we can filter down even more if needed to get a specific view of growing that radiology department, for example. From here, that HRBP can continue to learn a little bit more about what skills are needed, which ones are missing, what skills are most critical for the radiology department to continue to have it grow over time, and have the best types of people in that role, figure out where they need to really grow in this department. Now, some actions and little bits of AI that's alerting me to take are things like I can start a full new workforce plan, boost certain performance, even build leadership pipelines. From here, I really need to grow this department over the next year and make sure I actually have a workforce that's set and ready for the staff that I have. So let's go ahead and start a new plan. Even within that workforce planning system, it can easily guide me to the next step. So let's choose future-proof to our staff to set some specific targets. When I do that, I have an easy and simple 4-step plan that I can collaborate with the right team members, have a specific focus, and have the AI actually help me through this process. So in this process, I can select even specific types of roles I want to target and focus on. And in this, it's letting me know that I'm going to need to, over the next 12 months, increase our headcount specifically. However, with the rapid pace of technology advancements in the healthcare, we know that this is going to require organizations to invest in training, upskilling with their staff, with new technologies and practices. So finding candidates with the necessary technical skills can be a challenge. Why not look at internal and external candidates that might need some work too? So from here, I know we're going to change this percentage because I know we're going to increase a little bit more, and we're going to go ahead and view what that plan looks like. Overall, I'm seeing with this plan, I've got a number of good fit employees and a lot more employees that I can develop with some of those technical skills and on-the-job training. This is going to bring me to a dashboard with this plan to help me understand in the radiology department for this workforce plan. Here are all my employees that are ready now, including different areas of where they've been in the long-term role, who's top performers, and who would be really good based on succession plans I can even set up. But who's also the employees to develop? We've got a lot more of those. So who are those A, B, and C potential fits that we can actually start and develop a whole learning plan for? So that is a quick way of how we can set up some of those plans, set up again, workforce planning and succession all within this one system, while still taking a look at some of those skills that we can improve on. So thanks for catching this session. We've covered career pathing from employees' perspective, and we've also set up a future-proofed plan to help grow our staff in that radiology department. Addressing these hiring challenges really require a strategic approach that focuses on talent acquisition, retention, and development. Healthcare organizations can benefit from implementing innovative recruitment strategies, investing in employee training and development, and of course, creating a positive work culture that supports the employee well-being. You can do all of that within this platform. Thanks for watching.
Well, it was an incredible day of learning and inspiration here at Phenom Industry Week. We've seen how crucial it is to support and retain healthcare workers to ensure quality care. Thank you to all of our speakers and to all of you for participating today. Our team showed you Phenom High Volume Hiring and Phenom Talent Intelligence, the powerful Talent Experience Engine, and Phenom Career Pathing and Employee Experience Management. If you want a deeper dive on any of these products mentioned today, have a conversation with our team. They can personally walk you through any of your questions. Just go to phenom.com and reserve some time. All of today's sessions are available on demand in an hour or so after we wrap up today. so please revisit them and share them with your colleagues. Tomorrow, we'll be focusing on the manufacturing and transportation industries, where we'll explore how to build better workforces and tackle talent logistics. See you at 10 a.m. Eastern tomorrow.